Hi and welcome viewers of Nursing Academy 101. In this video, we'll talk about nursing medical surgical digestive system, multiple choice questions and answers, part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all news. Question number 1. To prevent gastroesophageal reflux in a client with hiatal hernia, the nurse should provide which discharge instruction? A. Lie down after meals to promote digestion. B. Avoid coffee and alcoholic beverages. C. Take antacid with meals. D. Limit fluid intake with meals. The answer is B. Avoid coffee and alcoholic beverages. Question number 2. Which foods should a patient with GERD stay away from? All is true except one. A. Burger King double cheeseburger. B. Lettuce. C. Candy cans. D. Chocolate espresso. The answer is B. Lettuce. Question number 3. Which of the following is not a common symptom of GERD? A. Dyspepsia. B. Regurgitation. C. Dysphagia. D. Hyposalivation. The answer is D. Hyposalivation. Question number 4. Which drug class isn't used to treat GERD? A. Antacid. B. Histamine receptor antagonist. C. Beta blockers. D. Proton pump inhibitors. The answer is C. Beta blockers. Question number 5. Your patient is still MPO after 6 days from esophageal surgery, and he is now ready to start eating. In which of the following sequence should feeding start? A. Sips of water, full fluids, clear fluids, regular fluid, soft food. B. Sips of water, clear fluids, full fluids, regular food, soft food. C. Sips of water, full fluids, clear fluids, soft fluid, regular food. D. Sips of water, clear fluids, full fluids, soft food, regular food. The answer is D. Sips of water, clear fluids, full fluids, soft food, regular food. Question number 6. The patient attends 2 sessions with the dietitian to learn about diet modifications to minimize gastroesophageal reflux. The teaching would be considered successful if the client said that she will decrease her intake of which of the following foods? A. Fats. B. High sodium foods. C. Carbohydrates. D. High calcium foods. The answer is A. Fats. Question number 7. Which of the following dietary measures would be useful in preventing esophageal reflux? A. Eating small, frequent meals. B. Increasing fluid intake. C. Avoiding air swallowing with meals. D. Adding a bedtime snacks to the dietary plan. The answer is A. Eating small, frequent meals. Question number 8. Which of the following conditions can cause a hiatal hernia? A. Increased intrathoracic pressure. B. Weakness of the esophageal muscle. C. Increase esophageal muscle pressure. D. Weakness of the diaphragmatic muscle. The answer is D. Weakness of the diaphragmatic muscles. Question number 9. The nurse is obtaining a health history from a client who has a sliding hiatal hernia associated with reflux. The nurse should ask the client about the presence of which of the following symptoms: A. Heartburn, B. Jaundice, C. Anorexia, D. Stomatitis. The answer is A. Heartburn. Question number 10. Which of the following factors would most likely contribute to the development of a client's hiatal hernia? A. Having a sedentary lifestyle. B. Being 5 feet tall and weighing 130 kilograms. C. Using laxatives frequently. D. Being 40 years old. The answer is B. Being 5 feet tall and weight 130 kilograms. Question number 11. This patient with hiatal hernia and GERD is scheduled for upper gastrointestinal tract series, barium swallow. Following the procedure, the nurse should instruct the client to A. Increase water intake and take a laxative if needed. B. Follow a clear liquid diet. C. Administer an enema. D. Take an antiemetic. The answer is A. Increase water intake and take a laxative if needed. Question number 12. Nursing management of the patient with chronic gastritis includes teaching the patient to A. Maintain a bland diet with 6 small meals a day. B. Take proton pump inhibitors with meals. C. Use NSAID instead of aspirin for pain relief. D. Smoking half pack of cigarettes per day is allowed. The answer is A. Maintain a bland diet with 6 small meals a day. Question number 13. The nurse is caring for a client with chronic gastritis. The nurse monitors the client knowing that this client is at risk of which of the following vitamin deficiencies? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin E. The answer is B. Vitamin B12. Question number 14. You are assigned to care for Mr. Isam, who is a 50 years old patient diagnosed with peptic ulcer disease and just admitted for treatment. Which of the following plays a role in peptic ulcer formation? All are true except one. A. Helicobacter pylori. B. SAIDS. C. Zollinger-Ellison syndrome. D. Obesity. The answer is D. Obesity. Question number 15. Helicobacter pylori can live in the stomach's acidic conditions because it secretes base which neutralizes the acid. A. Ammonia. B. Ureas. C. Carbon dioxide. D. Bicarbonate. The answer is B. Ureas. Question number 16. Mr. Isam describes his pain to be relieved by food intake. In addition, he reports awaking in the middle of the night with a growing pain in the stomach. Based on the patient's descriptions, this appears to be what type of peptic ulcer? A. Duodenal. B. Gastric, C. Esophageal, D. Refractory. The answer is B. Gastric. Question number 17. The diagnostic test of choice in detecting gastric ulcer is A. A barium study of the upper GI tract. B. Gastroscopy. C. Urea breath test. D. Ultrasound abdomen. The answer is B. Gastroscopy. Question number 18. Mr. Aysam suddenly developed dark coffee ground vomiting. On assessment of the abdomen, you find bloating and an epigastric mass in the abdomen. Which complication may this patient be experiencing? A. Obstruction of pylorus. B. Upper gastrointestinal bleeding. C. Perforation. D. Peritonitis. The answer is B. Upper gastrointestinal bleeding. Question number 19. Mr. Aysam then also had melena, which is A. Black terry stool and indicates upper gastrointestinal bleeding. B. Fresh blood in stool and indicates lower gastrointestinal bleeding. C. Both A and B. D. None of the above. The answer is A. Black terry stool and indicates upper gastrointestinal bleeding. Question number 20. Which of the following tests should be done immediately to evaluate the amount of bleeding? A. Endoscopy. B. Upper GI series. C. CBCD. D. Arterography. The answer is C. CBCD test. Question number 21. Your patient now is planned for urgent gastroscopy. Which of the following is an intervention done to decrease the risk of aspiration during gastroscopy? All are true except one. A. Giving lidocaine puffs to the throat. B. Positioning the patient in a lateral position. C. The use of atropine. D. Keeping the patient MPO. E. The use of suction during gastroscopy. The answer is A. Giving lidocaine puff to the throat. Question number 22. This patient complained of back and epigastric pain, which was not relieved by medications that were effective in the past. This patient is likely to have A. Gastric ulcer penetration. B. Pyloric obstruction. C. Gastric cancer. D. None of the above. The answer is A. Gastric ulcer penetration. Question number 23. The diagnostic test confirmed that Mr. Aysam was positive for H. pylori bacteria. Which of the following is a treatment of H. pylori bacteria? A. Antibiotic, clarithromycin, amoxicillin. B. Proton pump inhibitor. C. Bismuth salts. D. None of the above. E. All of the above. The answer is E. All of the above. Question number 24. Which of the following is an example of proton pump inhibitor? A. Omeprazole. B. Famotidine. C. Magnesium hydroxide. D. Metronidazole. The answer is A. Omeprazole. Question number 25. Mr. Aysam peptic ulcer was refractory to treatment and he underwent gastric resection. After 1 month, he reported nausea, bloating, and diarrhea 30 minutes after eating. What condition is this patient most likely experiencing? A. Gastroparesis. B. Fascia dehiscence. C. Dumping syndrome. D. Depression effect. The answer is C. Dumping syndrome. Question number 26. For the mentioned condition above, which education you should give Mr. Isam to decrease his symptoms? A. It's the best to eat 3 large meals a day rather than small frequent meals. B. Eat a diet high in protein, fiber, and low in carbohydrate. C. Be sure to drink fluids with meal. The answer is B. Eat a diet high in protein, fiber, and low in carbohydrates. Question number 27. You know that this patient after gastric resection will need supplement of A. Vitamin B12, B. Vitamin B9, C. Vitamin A, D. Vitamin C. The answer is B. Vitamin 12, B12. Question number 28. During your morning assessments, which of the following patients should be your priority? A. The newly admitted client with acute abdominal pain. B. The client who needs an abdominal dressing change day 3 post-op. C. The client receiving continuous tube feedings who need the tube feedings residual checked. D. The sleeping client who received pain medication 1 hour ago. The answer is A. The newly admitted client with acute abdominal pain. Question number 29. The nurse is preparing a patient for planned CT scan of abdomen and pelvis with oral and IV contrast. Serum creatinine was taken the morning before the CT and was 1.8 mg per deciliter. By this result, the nurse knows that A. The patient can undergo the CT scan of abdomen and pelvis with both oral and IV contrast. B. The patient can undergo the CT scan of abdomen and pelvis with IV contrast only since the oral contrast is contraindicated in high creatinine. C. The patient can undergo the CT scan of abdomen and pelvis with oral contrast only since IV contrast is not given in high creatinine. D. Both oral and IV contrast are contraindicated and the CT scan should be postponed until serum creatinine returns to normal level. The answer is C. The patient can undergo the CT scan of abdomen and pelvis with oral contrast only since IV contrast is not given in high creatinine. Question number 30. You are an in-charge nurse in a medical surgical unit having a patient requested for ultrasound abdomen and pelvis and for barium swallow upper GI tract study, and both should be done without delay. Which action will you take? A. Do the ultrasound before the barium swallow. B. Do the barium swallow before the ultrasound. C. Cancel one of the two procedures depending on your evaluation to patient status. D. Postpone one of the two procedures for another day. The answer is A. Do the ultrasound before the barium swallow.